Is now starting. All attendees are in listen-only mode.
Hello, everyone. My name is Jo Donlin, and I'm the Director of Regulatory Outreach and Education at DORA's Division of Professions and Occupations. I'd like to welcome you to the second of 4 PDMP webinars. This event will focus on how prescribers and their staff can create delegate accounts in the PDMP. The reason why we chose this topic is because we received many questions about how delegate accounts work. So I hope the information will be useful to everyone participating today. Please know that delegate accounts are a great way for prescribers to save time by delegating PDMP patient searches to their staff. I'm now going to turn it over to Justin Whip as soon as I take one moment to thank the Colorado Department of Public Health and Environment. We are sister agencies in the state of Colorado, and they have been very supportive of the PDMP and all of our efforts to work with many prescribers and pharmacists to increase the utilization of this important tool. So thank you very much. And with that, Justin, please proceed.
Thank you, Jo. Welcome everyone to our second of 4 tutorials. Today we will discuss how to create a delegate PMP aware account and also how to use the PDMP as a delegate on behalf of a supervising prescriber or pharmacist. Now, first, I want to briefly discuss what Colorado law allows for regarding delegate access. The current state law allows prescribers and pharmacists to authorize up to 3 delegates to search the Colorado PDMP on their behalf. Delegates must create a personal delegate account and link their account to their supervisor or supervisors. They can be delegates for more than one supervisor. But delegates must be employed by or under contract with the same professional practice or prescription drug outlet as their supervising prescriber or pharmacist. Additionally, supervising prescribers and pharmacists are responsible for ensuring the delegate accesses PDMP information in accordance with state law. You may wonder what state law allows for. So prescribers or their delegates can access PDMP data for any current patient of the prescriber. Pharmacists or their delegates can access PDMP data for a patient to whom the pharmacist is dispensing or considering dispensing a prescription drug, or a patient to whom the pharmacist is currently providing clinical services. One other thing I want to stress here is before you register, you want to discuss this with your supervisor, and you will need to know your supervisor's PMP-aware login email address. This will be a required piece of your account registration. Now, to begin a PDMP account registration, you'll want to go to colorado.pmpaware.net and follow the Create an Account link. First, you will need to enter an email address and create a password for your account. Next, you will need to select your role. For a delegate, select the healthcare professional or delegate role. And then you will see down towards the bottom the options for pharmacist delegate or prescriber delegate. These are unlicensed roles in our system because Colorado does not have any license-based requirements for delegate access. You just must be working with your supervisor. When you hit continue, the following page will require you to put in your own personal information. When you scroll towards the bottom, you will see I am a delegate for the following people. And here's where you will need to enter your supervisor's email address. This must be the email address they use to log in to their PMP Aware account. When you hit add, if the supervisor is found, you will see them come up here. If the email address you put in is not associated with an account, you will not be able to proceed any further. When you hit continue, you'll get a message saying that your registration requires approval from your supervisors, and you may be subject to administrator review of your account. When you hit continue, you'll go to the final page where you can review the information you entered in your application and then hit submit and continue. At this point, you will get an end user license agreement that you must agree to, and you will not be able to access the PDMP until your supervisor approves your account. So the supervisor will receive an email from our system advising that there is a delegate account awaiting approval. Sometimes this can take a couple of minutes to arrive, but if you have your supervisor log into their account, they can follow the link underneath their name at the top right corner and go to Delegate Management. This is where the supervising prescriber or pharmacist will review the account and approve you for access. Once the account is approved, you as a delegate will be able to begin using the Colorado PDMP. The first and most important item in the PMP Aware web portal is the patient request option. This is found through the menu and under the AWARxE search header. When you select patient request, first you will need to select your supervisor. If you have more than one supervisor here, you will have to select the appropriate supervisor before performing a search. When you perform a search, you will need to enter the patient's first name, last name, and date of birth. And further down, you have the options of changing the prescription fill date history to a more narrow range or a broader range up to the last 7 years. And you will also be able to search other state PDMPs. The list of states that you see here are states in which Colorado has a data sharing agreement for PDMP data. There are also a number of states under the RX check option, including neighboring state Kentucky. You may notice that there is a smaller list here than what may be available for prescribers or for pharmacists, and that is due to variations in state laws on what is required for delegate access. Now, to perform a search, you can enter the patient's first name, last name, and date of birth. And you can change the fill date if you'd like. And then down here is where you hit search. You will end up with a patient report displaying here with prescription summary information, a list of the prescriptions the patients received, and a summary list of prescribers and pharmacies that prescribe or dispense controlled substances to the patient. You also have the ability to download this report as a PDF or as a CSV spreadsheet file, which can be accessed through Excel. Now, when performing patient searches, you also have the ability to do a partial name search. This is an option if you're having trouble finding prescription history for a patient. Perhaps the patient has variations in how they spell their name or have nicknames, etc. And this partial name spelling is a great way to troubleshoot that. So if you have a patient and you're struggling to find the rest of their prescription history, you can put in a partial name, minimum of first 3 letters of their first and last name. And this will also remove the date of birth requirement for your search. However, you cannot do a patient search with a partial name in any other state, so you will lose that ability to search multiple states when performing a partial name search. Now, if you perform a search like this, you may end up with multiple patients found. You can select one or both of the patients depending on which patient is a patient of your supervisor. Now, when you run that report, again, you will receive a patient report with summary information, prescription history, and prescribers and dispensers. And again, you can download that as a PDF or as a CSV file. Also available is a bulk patient search option. The bulk patient search allows you to enter multiple patients at one time and allows you to perform all searches with one request. So first, again, you'll need to select the supervisor, and then you can enter the multiple patients here. When you've added all of your patients, you can name them. And again, you can make changes to the prescription fill date history and then select search. There is also the ability to do this through a file upload. I'll first show you the results here when manually entering. You'll go to the bulk patient history and you will see your results here. And then clicking on each patient will allow you to view that report. Same format and same options that were available previously. Now, when you access this information, you'll also generate a request history trail where you can review all the previous searches that you've performed. Your supervising prescriber or pharmacist can also go into their request history menu and review all searches performed by their delegate. And again, if you are accessing this information on behalf of a prescriber, you may want to download the report as a PDF, included in the patient's chart so that it is immediately available for your supervisor. Other options within the account are updates to your profile. If you go to my profile, you'll have the ability to make edits to personal information, including your email address, and you can also add additional supervisors to your account after you've created it through this menu here. Again, this will generate a request to your supervisor to have them log into their PMP Aware account and approve you as a delegate. So that essentially covers the functions and features that are available for delegates. You will notice that that is less extensive than what is available for supervising prescribers, and that is the exact reason that the delegate account exists, so that delegates can access PDMP information for their prescriber without being able to view any other information that would otherwise not be available to them. So again, do not access the PDMP with your supervisor's credentials. You'll want to make sure you use your own delegate account. I also want to note that our website, dpo.colorado.gov/PDMP/training, has several resources available to you. We have PDF documents that cover items such as how to create a delegate PMP Aware account and the key functions and features available for delegates. Now, this is a little more extensive and detailed than the discussion that we had today. And there is also how to do a bulk patient search. We touched on that briefly in our webinar today, but if you want more information on doing bulk patient searches, I would recommend accessing this tutorial. Additionally, our webinars are available on this webpage. Last week's webinar for prescribers is available, and today's webinar will be available shortly under this link here. Now with that, I'll turn it back over to Joe, and we can take some questions.
Okay. Thank you, Justin. I'm wondering, we have a question from Carla. And I don't,
Okay.
Carla, I received your comment that the information is great, so thank you. But did you have anything beyond that? Any question you wanted to ask? If so, please feel free to just type it in the chat box. I do have a question for you, Justin.
Okay.
The question is, how often do I have to renew my account? And do I have to go back to my supervisor every time I do that?
That's a great question. We actually did recently enable an annual delegate re-verification process. The delegate does not need to take any action on an annual basis, but their supervising prescriber, essentially once per year, will need to log into their account and verify that the delegates currently listed on their account still work for that supervisor. So that process entails an email to the prescriber, giving them 30 days to log in and review their delegates and verify them. If any delegates are not re-verified in that 30-day window, the delegate's account will go into a pending status, and the delegate will not be able to search on behalf of that supervisor until they re-verify the delegate. One other thing to note, we get this question a lot. A prescriber or pharmacist can only have up to 3 delegates on their account at any one time. So if you're a supervisor and you have 3 delegates currently linked to your account, you would need to remove one of them before adding a new one. So you can only have 3 at any one time.
Okay. The next question for Justin is, how are supervisors monitoring the use of the PDMP to make sure delegates are using it appropriately? I think you went over that, but it was sort of quick. So Justin, can you talk about that a little bit more?
Yes, so the requests history feature, which I mentioned, I'll go back here to show that option. This looks a little bit different, the menu does, for prescribers versus delegates, but the request history for both is under this RX search section and then requests history. So if you are a supervising prescriber, you will see record in here of all of your own searches as well as your delegates. You'll see here the requester link lists you, because this is the delegate's account, but the supervisor in that section will see which delegate would have searched those patients. And it is the responsibility of the supervisor to ensure that their delegates are accessing the PDMP appropriately.
So Justin, just to be clear, what you are showing on the screen now is what the delegate would see if the delegate goes into their profile. And there is the same feature when a prescriber goes in, but the report might look a little bit different, but they're both called report history, did you say?
They're both they're both under the RX search request history. And here is where the information may be different under requester. So if you're a prescriber or a pharmacist, you will see your own searches as well as your delegate searches, and the requester will list who performed that search.
The next question is, do delegates have to be credentialed? Example, can an LCSW be a delegate? I believe that the question is anybody that the prescriber wants to have, but go ahead, Justin.
That's correct. As we mentioned briefly at the beginning, there are not any specific license-based requirements for delegates, but they must be employed by or under contract with the same professional practice or prescription drug outlet as their supervising prescriber or supervising pharmacist. So we don't have any license-based requirements. Some other states do specify delegates must have some type of specific license. And that is why the list of available states for delegates when searching the PDMP is not as extensive as it may be for pharmacists or for prescribers.
Okay, thank you. I have another question, but if you have a question, please be sure to type it in the box and it'll pop up and then we can get to it. Let's see, the next question is from an office manager. So are you saying that I could go in and check multiple people at the beginning of the day and insert the reports into my provider's medical records for the patients that will be seen that day?
That's correct. That is essentially the point of having delegate access available so that someone on the staff can perform these searches on behalf of their supervisor. The PDF printout version of the report is a pretty convenient format for putting into the file so that the prescriber has that immediately available. Again, when performing those searches, you can download it as a PDF through this link here, download it as a spreadsheet in CSV format. When you download it as a PDF, it pops up and becomes available as a printable document just like this. The search, again, can be done with one-time searches or the bulk patient search. The bulk patient search is probably ideal for running all the reports at the beginning of the day. Again, you can just put in the first name, last name, date of birth, and add them. The zip code is not required when doing a bulk patient search, but it is available. Additionally, there's an option to upload a file for the bulk patient search. If that is the case, but you prefer to load a spreadsheet, you can view the sample file. And when you open this, you can enter a list of first name, last name, date of birth, save that file, and then you'd be able to choose the file here and upload it. And when that's uploaded, it will, just like entering them manually, run all of those searches at once. And then to retrieve those reports, you'll go to the bulk patient search history. And that's where you'll be able to view each individual report, again, in that same format that we discussed previously.
Okay, I have another question for you, Justin. If someone leaves our office and goes to a different job and works for a different provider, is it the person's responsibility that leaves to change the account, or is it the supervising prescriber's responsibility to go in and delete that delegate account?
Well, the supervising prescriber is ultimately responsible for the delegate's access to the PDMP. Now, the delegate could make changes to their own account, but the supervisor should go in and remove any delegates that do not work for them any longer through that delegate management section of their account. Again, that is under the name at the top right, and then delegate management. So here we can go in and remove a delegate, and that will disallow that delegate from being able to search on behalf of that provider. You can also reapprove that delegate if you make any mistakes, or if you have more than 3 delegates and need to make changes on which 3 are actively approved for delegate access.
Okay, and this is the last question I see on my list, so and we're getting close to the end, but is there a limit on the number of searches a delegate can make on a particular day?
No. No, the searches can be performed through that bulk upload, or it can be done on a one-at-a-time basis. It's really up to you on what's most convenient and efficient. But if a delegate's looking to perform, say, all the searches for all the patients for a prescriber on a particular day or even week, the bulk patient search may be the way to go with that. We will have another tutorial on bulk patient searches later, and there is a tutorial document available at dpo.colorado.gov/PDMP/training, which will cover, again, creating a delegate account, the key functions and features for delegates, as well as the bulk patient search. We also have 24/7 general technical support available at 855-263-6403. And you can also contact me, the state administrator, at pdmp.inqr@state.co.us if you have any additional questions.
Alrighty, I think that concludes today. I just want to remind everybody, as Justin mentioned, on August 14th at 12:30, we will have the next webinar in our series, and it will focus on unsolicited reports. And on August 21st, the 4th and final in the series will be presented, which will focus, as Justin just mentioned, on bulk patient searches. So I hope that everyone found this helpful today. We are excited about the number of delegate accounts that are starting to be opened, and we hope that it will really help save your prescribers time so that you can all work as a team when utilizing the PDMP. So with that, I wish everyone a good weekend, and thank you so much.